Good morning, my friends. Oh, it's not morning. Good afternoon. This is Dr. Logan from CellMed Clinics. I will tell you what, it's been a busy day, so forgive me for not knowing what time of day it was. This morning, when I woke up, my eyes open, and I had to think about actually what day of the week it was. So, some of you I know can relate to me right now, but I digress. All right, so today I want to talk about shoulder pain. Shoulder pain is definitely a pain that has been on my mind lately. I've been seeing a lot of patients who have shoulder pain over the last few years, and I think that shoulder pain is largely overlooked and often misdiagnosed. So I want to share a little bit of information about that. Shoulder pain is actually the third leading cause for missed work in the U.S. The first leading cause is low back pain. Knee pain would be the second leading cause, and shoulder pain would be the third leading cause for why people miss work. So it's definitely something that is affecting a lot of people. But here's the thing. When I see patients coming in, they often come in with a diagnosis that is very generic, right? You have arthritis, or you have a rotator cuff injury. So I want to dig into that a little bit because I think it's really important whenever we're addressing any kind of pain that we actually get down to what the cause of the pain is. And not just be focused so much on what the specific treatment is. And I do get a number of patients who contact the office and they say specifically what treatment it is that they want in order to address their pain. Sometimes that's accurate, and sometimes that is the treatment that we would normally use. But if I never do anything in my life other than this, I want to make sure that I'm practicing medicine that makes sense. That I'm not just doing injections for the sake of doing an injection to run up a bill. That doesn't make sense to me. I got into medicine because I wanted to make a difference, because I wanted to help people understand what their treatment options were, and that I wanted them to have more treatment options than I had been given in the past. And so when I come across situations where people are adamant about this is the treatment you should do on me, I pause, because first and foremost, I want to make sure that the treatment that I'm doing is actually the right treatment for what's causing pain. So when we think about the shoulder, it's really important to understand that there are four major muscles that keep your arm on your body. This is a good thing. We don't want your arm falling off your body, right? Nobody wants that. But the rotator cuff muscles are such a small fraction of all the muscles that work together in order to create movement in the shoulder. And so when we get just a blanket diagnosis, oh, it sounds like it's a rotator cuff muscle, to me, that's a real easy grab. Now, it might be a rotator cuff muscle. It might be a rotator cuff tendon issue, tendinitis, tendinosis, a tear, a rupture. It could be any of those things. But I hear it so cavalierly diagnosed that it kind of rubs me a little bit wrong, I guess. Just being very transparent about that. Here's the thing. There are 26, I think 24 or 26 muscles that make up movement of the shoulder. And that's great because we've got a lot of movement that we need to do, right? If you can't raise your arm to put your shirt on, or you can't pull your arm behind your back to clasp your bra, like that's a life-altering problem that we need to take care of. But I want to make sure that we're taking care of the right problem. And when we have muscles that are doing the job that a tendon or a ligament should be doing, we can get a lot of pain with that. And that muscle can be many other muscles besides just the rotator cuff muscles. All right, so let's back up a little bit. Structurally, muscles do a particular action. They are movers. right? And then our tendons and our ligaments are stabilizers. And we see tendons and ligaments oftentimes around joints, but that's not the only place that we see them. They connect our muscles to the bones, and then they connect bones to bones. So it depends on what area of the body that we're talking about. But since I mentioned shoulder, we'll stick there. So the tendons, the rotator cuff tendons, are attaching the rotator cuff muscles to the ball of your shoulder so that your arm doesn't fall off. But don't forget, we have pec muscles in the front. We have traps that are involved in shoulder movement. We have latissimus dorsi that's involved in shoulder movement. We've got serratus anterior, which comes along the side by your ribs. That's involved in shoulder movement. Our biceps and our triceps muscles are also involved in shoulder movement. So there's more than just the 4 rotator cuff muscles that we should be looking at whenever we're attempting to diagnose an injury or a pain-generating structure involved in shoulder movement. We can have things like osteophytes, which are calcium deposits in the joint, around the joint. Tendons and ligaments can rub on them. They can be quite painful, but oftentimes you don't even know you have them until they become a problem. And so, again, I say that it's really important to get down to what the problem is. Is it an inflammation problem, right? Tendinitis, tendinosis. Is it an osteophyte? Is it a torn labrum? Is it a breakdown of cartilage in the shoulder joint itself, osteoarthritis? Is it a different type of arthritis? Is it an inflammatory arthritis like rheumatoid arthritis or psoriatic arthritis or gouty arthritis? Right? Is it an AC joint problem? Is it a biceps tendinitis? Is it a trigger point in any of those 20-something muscles that we have that connect onto the shoulder? Because sometimes the radiating pain that comes down, especially the back and the middle part of your shoulder, oftentimes it's not generating from the back or the middle part of your shoulder. That's generating from your rhomboids or from your levator scap muscle in your back or from the splenius muscles that go up your neck. And we can get that referral pain and that referral pattern down the arm. So again, I come back to it's really important that you make an accurate diagnosis before you start applying a treatment to it. And I find that so many people, when they go in with shoulder pain, they're met with rest or medication, cortisone shots, or physical therapy. But the actual accurate diagnosis is sort of left to the wayside. Frankly, that's very frustrating for me as a practitioner, because if we don't know what we're treating, then how can we actually choose the best treatment? So I've recently been running some Facebook ads, and I talk about injection therapies. And to be honest with you, there's multiple types of injection therapies. Some of them are regenerative injection therapies like stem cells, prolotherapy, PRP, exosomes, birth tissue biologics. We have like 5 different types of regenerative injection techniques. But what people often don't know is that there's trigger point injections, there's mesotherapy, there's neurotherapy, there's natural substances that can be injected. And so there's a plethora of types of injection treatments that we can use. And that's just talking about the treatments that are used with a needle, right? What about all the other things? What about percussion therapy? What about massage therapy? What about movement assessment? What about corrective movement? All of those things need to also be properly applied. So it's not even enough to just choose the right single treatment, but it's important to choose the right set of treatments that can go together to create healing in that area. And so when I'm talking with patients, I really like to understand how they're moving, what their movement patterns are, what their body looks like. Are they sitting with one shoulder hiked up? Are they shitting with the shoulder rolled in front? Because that gives me a lot of information. How do their arms move? What happens when I move the arm versus when the patient moves the arm? Right? What are the orthopedic tests? What are the muscle tests? What muscles are being affected? Are there trigger points in those muscles that are causing the radiating pain? And maybe the tendons and ligaments are intact just fine. Maybe there's some arthritic condition in there. Maybe it's what's causing the problem. Maybe there's a labral tear. Maybe there's a ligament laxity, and so the joint is unstable because it's had like a subluxation or a partial dislocation or a stressing of the joint that caused the ligaments and tendons to kind of really stretch out, and perhaps they didn't heal accurately. All of those things are possibilities. And if you're not looking at all of those things as possibilities, then it's really difficult to choose the exact one treatment to fix the pain. So I say all of that to say this. It is extremely important that you get the right diagnosis and really figure out what is happening in the shoulder that is causing the shoulder pain, as opposed to just throwing a whole bunch of mud at the wall and hoping some of it sticks. So there are definitely times when one treatment makes sense for a variety of ailments, right? But it doesn't negate the fact that we really need to understand what the problem is, what we're trying to fix, what is our goal of treatment, what are we expecting to happen from this treatment, and using all of the tools that we have, including history that the patient gives, and physical exam that the doctor should be doing, and imaging if that makes sense, and doing the right kind of imaging. If you come in and you say my shoulder hurts and I send you for an x-ray, that's going to give me a limited set of information. It's really not going to tell me much about the soft tissue. So your x-ray may look perfectly fine, but it doesn't change the fact that you can't put your bra on at night, or I guess you would put it on during the day. But you can't wrap your arm around to your back to get properly dressed. So I come back to, you've got to have an accurate diagnosis before you can choose the most accurate treatment. So don't forget, cortisone, PRP, stem cells, those are great tools when you use them properly and when you're using them for the right thing, but they might not be the right treatment. There might be other treatments that can be equally effective or more effective and cost less. And so, like I said, if there's anything I want to do in the world, I want to do medicine that makes sense and not just medicine that makes money. Like, I'm kind of over the medical system right now and the greed of money. But that's a whole different soapbox for a whole different day. I will let you go on that note. Give us a call if we can do anything to help you. And I would love to be able to, assist you in your pain condition and getting you back to normal form and function as soon as possible. So I will look forward to hearing from you. Drop a heart, share, click, like, comment. Would love to hear it all from you. Hope you guys are having a great day. See you soon. Dr. Darla. Bye-bye.